Hello, my name is Narod Odabasiyan, and I am a marriage and family therapist, as well as a psychotherapist affiliated with the CBT clinic. And I'll be presenting on generalized anxiety disorder today as part of the Dr. Michael Spevack fall lecture series. So, what I would like to cover in the 30 minutes that we are together is the following. What is generalized anxiety disorder? Briefly, I'll touch on what do the statistics say, what are some of the causes, how come and why is it maintained, and how can we overcome it by using cognitive behavioral therapy. So, what is generalized anxiety disorder? There are negative thoughts, images, doubts we all have involving the future, uncertain outcomes. They are related to work. It could be about health and our wellness, relationships, finances. It could really be anything. It is a lot of what if then scenarios are constantly replayed in our mind. For example, if I fail this exam, then I'll never get to grad school. What if I lose my job and then I become homeless, excuse me, as well. And if I get sick, then I might die. If my partner leaves me, then I will never be loved. As you could see, it's this constant what if mentality and is usually relentless and uncontrollable. Now, I'd like to differentiate what is generalized anxiety disorder from regular worry and regular anxiety that we all have. So in order to have generalized anxiety disorder, all these sort of points need to exist. Now, our anxiety needs to be excessive, and we must worry more days than not for over 6 months. It means we have lots of difficulty controlling the worry. Three of the following need to come into place as well. There's a lot of restlessness, a lot of fatigue caused from the excessive worry, lots of difficulty concentrating and focusing on tasks, lots of irritability, muscle tension, sleep disturbances also exist. Now, they need to be significantly distressing and they have to impair our everyday lives. Also, they're not due to other substance abuses or medical issues, and the disturbance is also not explained by any other mental disorder. If these exist, then it means most probably we do have generalized anxiety disorder. And what is the prevalence out there? Now, again, normal worry with occasional and brief anxiety is normal. We all feel it. However, it becomes generalized when it actually hinders and interferes with our everyday functioning. We all worry time to time before an exam, before an important event, before our first day at work. So I like to sort of make a difference between what regular anxiety is and what GAD is. And usually GAD, what we see in the population is 7% of the population are usually having this disorder, and twice as many women than men. And most often, unfortunately, it might take more than 10 years for individuals to seek help to overcome generalized anxiety disorder, and most often it precedes depression. Now, what causes GAD? Well, as we know often, it's a mix of genetics and environment, biology, nature, and nurture. So a little bit of, if we have parents, for example, or siblings who have anxiety or have a certain predisposition to general anxiety disorders. In regards to our environment, well, watching a parent worry constantly, growing up in an unstable home environment, multiple divorces, blended families, and conflictual relationships seen within the home, Another cause could be given too much or too little responsibility early in life. It could go either way. It could be experiencing a traumatic event early in life that sort of shook you, and because of it, you sort of have constant anxiety. Being bullied as an adolescent or a toddler, repetitive bullying, as well as having abusive parent or caretaker. All these, or a combination of some of these causes, can actually cause GAD. Now, what makes us what are the maintaining factors of general anxiety disorders? How come it's there to stay in some of the cases and not in others? Well, number one, people who excessively worry have positive beliefs about worry in general. Okay, for example, they might believe falsely that if they worry, then their worst fear won't happen. If, for example, they might even say, well, worrying shows that I'm responsible and I'm caring and loving. If I worry, then it prepares me to the worst case scenario and I'm prepared to tackle the situation. Now, is that so? A question I ask you. Another maintaining factor is basically approaching problems with a negative mindset. Now, most often, anxious people are not necessarily worse at problem solving. They have all the skills to problem solve. It's just how they approach a problem is what causes the difficulty. Now, lastly, it's one of the third points as well is the intolerance of uncertainty. So for the uncertainty is quite scary for people who are highly anxious because the future is scary. I need to be certain now about the future, so they will do anything and everything to want to control the future. They all the strategies they design to help themselves feel more certain, actually, by planning or worrying or researching, actually tend to backfire. Why? Because so many uncertain answers to what if, isn't there? There are multiple answers to the what if. So how often, how long are you going to take to prepare? What if this and what if then? What if? So unfortunately, the time is spent in researching versus action-oriented behavior. Lastly, what maintains it is cognitive avoidance. Now, what is that fancy word in psychology? Cognitive avoidance. Well, in a snapshot, basically, it means that we use distraction to stop the worry. For example, excessive worry prevents processing of other fears. It prevents us from actually being sort of attuned to other emotions, for example. So it's easy to distract ourselves as well by doing other things than actually being in the action of doing something. I mean, if you're in your head and you're avoiding situations that cause you to worry, well, it's also physically and mentally tiring to constantly worry. If we looked as well, took some time together in looking at the common symptoms. Now, I've sort of segregated it in 4 different sort of subsets. If we just look at our thoughts, what is it that we would notice in our thoughts if we're anxious worriers? So what we usually do in our mind is we overestimate danger and we underestimate our coping resources. And and all the help that might be around us that can actually be available if we did have an issue, a problem, a danger. And most often in our mind, we look at the worst case scenario constantly. So everything is big, catastrophic, and we need to worry. If we look at sort of affect and our feelings and emotions, if we're anxious worriers, well, what happens? Usually individuals are always nervous, they're panicky, obviously anxious, they're constantly on the edge, and it's relentless, as I mentioned before. It's in their body, in their mind, in their physical sensations, and even what are some of the physical sensations they do also feel and sense is most often, though this is not an exhaustive list, it's very individual to most, sweaty palms, gurgling in the stomach, a rapid heartbeat. Sometimes people talk about tightness in the chest, even in the arms, even tingling and dizziness is another symptom. Behavior-wise, what do they do? So, as quickly mentioned briefly, behavior-wise, well, avoiding any anxiety-provoking situation or running away from a situation, and constantly being in the action, if I could say, of perfecting or controlling a situation versus problem solving in a more sort of helpful way, and running away by using some safety behaviors. So what are safety behaviors? I like to also make a differentiation between our coping and safety behaviors. Safety behaviors have a purpose to eliminate the danger. And I'll give you an example in a minute. And coping behaviors will help us approach, stay in, and manage the situation that's in front of us. So, for example, an example of a safety behavior could be, I am unwilling to submit my report because I'm not sure if it's perfect enough. So before I do it, I'll call my best friend. And after I call my best friend, I'll make myself the ramen noodle that I wanted to, and then I'll get to it afterwards. So the safety behavior in calling her friend, well, of course, it was pleasure principle for that 15 minutes. We were distracted, heard a funny story, and then we ate our favorite supper. But yet, in the long term, we didn't get the report writing done or did not do it on time, and we feel more awful about it. A coping behavior help us, like as I mentioned, manage the situation and or an event, and which makes it in the short term more fearful, but in the long term, actually, we stayed in the situation and we coped with it and get something done. For example, in the short term, safety behaviors, obviously also, even though the anxiety decreases, in the long term, it increases, and the anxiety comes quicker and within shorter period of time. And although coping is difficult, but it does decrease the anxiety on a long-term basis. Basically, if I was to put the anxiety on an equation, this is what Dr. Stéphane Bouchard mentioned, and I thought it was a good symbolic way of looking at anxiety. Basically, highly anxious people look at danger or threat as the consequences of whatever that situation is, could be really bad or catastrophic, for example. And the probability of something really bad happening is probably pretty high. And the imminence, as in the short term, it probably will happen soon. And we underestimate, basically, on the other end, our personal coping skills and our internal resources to deal with the danger. So, if we were to take some time and look at, well, what does excessive worry get us? What happens to us? Well, it makes it really difficult to be productive. Highly anxious people also tend to be quite the procrastinators. And they get involved in multiple tasks, yet all the tasks are left undone, and they never get to sort of ticking off that box and said done, because of the uncertainty, because of the need to control, as we mentioned briefly. Other effects were, as I mentioned as well, some physical symptoms we might feel in our bodies, headaches, constant upset stomachs, tinglings. It affects our sleep. It also strains our relationships. How so? Maybe we might become over-dependent on our partners, boyfriends, girlfriends, etc., by constantly wanting to check and control and ask their opinion, and because we're searching to make the uncertain certain. And sometimes it can also lead to substance use disorders, sort of numbing ourselves with alcohol or drugs, because the anxiety physically as well is too much, so we want to calm ourselves down. Well, one interesting sentence I came across I wanted to share with you. I mean, don't believe everything you think. And unfortunately, some of the highly anxious individuals, they think, well, they feel a certain something. If they feel a certain way, if they think a certain something, then it must be true. And that is not the case. Let's talk about how to now basically help you if you do have a generalized anxiety disorder. Well, cognitive behavioral therapy is for you. What is CBT? CBT works on the premise that our thoughts about a certain situation or an experience powerfully affect our emotions and our behaviors and our physical responses to it. Everything is interrelated. There's a situation that triggers a thought that might trigger a feeling, physical sensations, vice versa, behaviors, vice versa. And then because of the behaviors we might show and the physical sensations we might have, well, repetitive thoughts come to play once again. So the CBT's objective is ideal. It decreases the symptoms we might feel and completely treats all the symptoms that we might feel as well. It actually shows that this approach shows improvement in any problematic of mood disorder related issues, between 60 to 90% improvement with the CBT approach, and in a long-term well-being as well. This type of therapy is considered as a short-term brief therapy, limited in time. It is more structured and can be seen as a little bit directive. And it deals with the problems in the present, in the here and now. And it's based on an educational model. Hence, homework and assignments are an integral part as well of this approach. How can it help? Well, the CBT, you can develop new ways of thinking about your anxiety, so you can break out of the vicious cycle. It can give you techniques that can be applied consistently and systematically. It can also, as I mentioned, one of the premise is homework in between sessions, and just like anything else in life, if these skills are practiced in between sessions, well, practice makes perfect. Practicing, obviously, just like anything else at the beginning, is very difficult, but with persistence, then some of our thoughts, for example, become, less and less problematic. And it's easier to sort of put in place some of the concepts of CBT. how would we look at the treatment plan? Again, quickly, just to give you a quick idea as well. Initially, what we do in session is to challenge some of the dysfunctional beliefs I quickly mentioned, and I'll mention more in a bit. For example, how do we challenge some beliefs? Instead of looking at if a negative event is possible and I need to worry about it, can we look at if a negative event is probable, then I want to address it. Another way of a belief is if there are events that I could not cope with, then I should sort of flee. Well, instead of, can we look at more of a healthy way of looking at it and say, I may not wish to face a difficult situation and we're an event. Ultimately, who does? But if faced with it, I can cope. Worry helps me prevent adversity or prepare. Really, does it? Can we look at an alternative way of thinking? When I worry, I don't problem solve and I procrastinate. Worrying shows I am responsible and caring. Isn't being responsible, taking reasonable steps and actions? Isn't caring more about loving and trusting oneself and others? These are questions I ask you. Worry works. Again, does it ultimately in the long term? Worry can be useless if we over-worry. What is useful is to take steps and trust our resilience. Usually there are sort of unhelpful ways of thinking as well, sort of unhelpful thinking styles. I won't go into all of them, but I like to mention some of them that are not necessarily just related to general anxiety disorder, but other mood disorders as well. Usually highly anxious people think in very all or nothing terms, as in black and white thinking. Their mental filter, for example, only paying attention to certain types of evidence, as in negative, and not looking at the positive come in and saying, oh, I was successful at this 2 weeks ago. Jumping to conclusions, mind reading, fortune telling, for example, predicting the future, labeling, calling ourselves stupid, idiot, or others sometimes. Overgeneralizing as well, seeing a pattern from one single situation, one single mistake, and saying, this is who I am, this is how it's all going to be, this is how it's going to end. Using should, must, ought to, which unfortunately, by simply using these words, automatically it already makes us feel guilty about something from the get-go. Another way of negative thinking style is personalization. So sort of coming back and saying, no, this is my fault. I made this happen. Taking full responsibility for something that you shouldn't necessarily. Or it can also be the other way around, blaming others when they could have been something that you might have contributed to, for example. So these are all unhelpful thinking styles that make us, stuck in a certain way of thinking. And so we challenge these behaviors in session. Next comes the important step of learning to accept uncertainty, because individuals who are highly anxious and have GAD have a very low tolerance to uncertainty. It's mostly like an allergy, a phobia. And most of you have heard about phobias about snakes and elevators and difficulty driving a car. Well, for worriers, excessive worriers, uncertainty is a phobia. Thinking about every possible outcome makes the uncertain situation seem less uncertain and more predictable to them. And worry is often a protest against this reality. It provides a false sense of security, a false sense of control. I do have some control by reasonable action. Worry does not buy me any more control. Maybe we can go over together the uncertainty cycle for some of us who are highly anxious. Well, worriers basically have a very elevated evidence requirement. They need proof that to be certain about something before jumping into the action. And then what happens is, well, there's excessive worry. They're not certain, and anxiety comes about because of some of the dysfunctional beliefs that we just mentioned a minute ago. Not being certain for them is a problem. And problems for most are threats. And because that's seen that way, and because problems are threats, we need to gather information. Possible versus what we talked about, probable and relevant, and look for perfection and control instead of taking action. Because we can't find the perfect possible scenario in our head, in a perfect solution, excuse me, then we feel out of control, even less certain. And this simplifies, again, the cycle of not being certain, worrying and anxiety, trying to look for, probable, relevant situations, and there are none, unfortunately, and losing our time, and the vicious cycle just keeps on perpetuating itself. How do we deal with uncertainty then? Well, as I mentioned, worriers are not any worse at problem solving. They only tend to get in the way of generating solutions to their problems. So a relentless attempt to increase certainty are ineffective. They're exhausting and tiring and fruitless. As we all know, complete certainty is really unattainable. We just don't know what's going to happen in a few minutes from now or the next day. A more effective strategy is perhaps working on your ability to tolerate the uncertainty. Now, learning to tolerate uncertainty takes lots of practice and some experimentation to begin helping those dysfunctional beliefs and changing them. And problem solving what is solvable and letting go of things that are cannot be solved through setting goals and action plans. Setting goals such as, what will help me to reach my goal? We can make a short list and perhaps look for signs of improvement. Am I reaching my goal? How am I reaching my goal? How am I showing signs for improvement? Am I doing a little bit more activity? Am I sleeping more better? Am I smiling more? For example, and action plans, if making concrete action plans about certain things in a very concrete way in regards to what's my goal, what are some of the actions I might take, when will I begin this endeavor, what are some possible problems I might encounter, and what are the solutions I might have to face these problems, and how do I sort of, again, assess my progress? So make it short and sweet, attainable with clear actions, timeframes, possible situations that could be problematic, with a possible strategy to overcome those difficult situations and move ahead. Now, lastly, I like to discuss exposure as well. That could be a part of it is part of the treatment plan of GAD. And what does that mean? And I'll briefly touch on that. Basically, being one with anxiety, being in it. We need to learn to approach situations and people we avoid. The only way to increase our confidence actually in our ability to cope is actually be with the fear. How do we do that? Well, together with a therapist, we can develop a hierarchy on a fear ladder. Okay, basically, things that we've been putting off and avoiding because of our anxiety. Now, helpful to develop together what situations we avoid, people we avoid, events we fear, for example, and we write it in the order of fear intensity from the most feared on top to the less feared on the bottom, and we will start very slowly approaching situations in which you can experience a small amount of fear, and so on up the ladder. So basically what we're saying is to adopt a mindset that it is good for you to take small risks and challenge yourself. We can make trying new things perhaps a regular part of our life. And we can start very slow, for example, trying a new activity as part of the bottom of the ladder, whatever makes you anxious. It could be anything. If uncertainty, if you always have the same toothpaste, something as, easy as trying a new toothpaste, or talking to a friend you've avoided for a few months because you feel, oh, I'm not sure what they will say because I've been ghosting them for a couple of months. Well, start by texting, see how they respond. And for example, writing an email to your boss that you've been you rather not write to because you'd rather not have anything in written, by just maybe starting with a brief hello email about something mundane about your work, and not having to check it 3 times before you send it, and actually send, some basic things that you've been avoiding because of anxiety. This is how we will make it workable for you, so that you can try to basically build a tolerance of uncertainty muscle. It's just like any other muscle in a way. So you'll need to practice. More practice, regularly practicing, will help you reach the top of your ladder by maintaining, an open approach, and also focusing on the outcome of your little experiments, behavioral experiments, if you like, and not only on the emotional experience. And then keep track a little bit, even if it's just in your mind, is what did you learn from that experience? What was new? What did you like, for example? Now, if we looked at the pure principles of exposure, well, for people suffering from generalized anxiety disorders, there are behavioral experiments, as I mentioned. There are also what we call cognitive exposures to certain scenarios, catastrophic scenarios, for example. So we might write a scenario about your worst fear in session together, and then replay that experience. And for example, over time, we will notice that initially when we read that scenario together, your anxiety over time will be quite high. It will plateau after some time and then go down. The more we practice the skill of just reading the scenario, and we repeat this daily, for example, well, you will attain the blue curve eventually. So if we were to compare, for example, a little bit about the 2 curves I mentioned, using avoidance and safety behaviors and coping and exposure, well, this is how the curve will look. If we use safety behaviors, the left graph shows you how anxiety is high, you used by, calling a friend or going out with a best friend and playing soccer, while the anxiety went down because you avoided, you actually left the anxiety provoking situation event. So of course the anxiety went down, but the next time you sit in front of that computer and think about the report, well, the anxiety will go up again. So safety behaviors, the chart and graph will look a little bit like what it looks like on the left. If we practice certain behavioral exposures, behavioral experiments, and we do exposure together, and we cope and stay with the uncertainty, the graph will look like the one it looks on the right. Eventually, with lots of practice, the anxiety curve will be what you see on the lower end of this graph. Lastly, as a treatment as well, now that we've done, challenging some of our beliefs, looking at our negative mindset, doing sort of what more action-based exposures, we need to maintain and manage our anxiety, just like anything else in life. So how do we do that? Well, we can use some mindfulness and acceptance techniques. We can practice staying in the present moment. There are multiple ways of doing that, but unfortunately, this is not necessarily the conference to do that. Another maybe important technique is breathing, because individuals who actually are anxious have more of a shallow, irregular breathing style. So we need to learn how to have more of a balanced and deep breathing. And this is also something that could be done quite with certain tools that could be shared. Imagery also could be helpful. It could help you come down before an anxious situation. And there are many others that are very individual to you. So physical exercise, going to the gym twice a week, twice a month, self-care, sleeping better, taking up an art class or karate lesson, going out of your comfort zone and maybe doing a lesson with your children, taking piano with them, or karate lessons, and trying other things that can also, in between the techniques that you've learned, help you maintain a more of a healthy lifestyle. So if we were to sum it up, what would we say? So for those highly anxious individuals, we would say, well, let go of incorrect beliefs about worry. The what if thinking style really does not get us anywhere. Maybe letting go of some problematic behaviors, challenging our thought distortions. Is there no gray zone? Is it true that it's true or false in this situation? Could there not be a gray zone, for example? Could your boss not have said hello to you, not because you didn't submit the report, but because she had a fight with her boyfriend the morning of, and she didn't notice you were, I don't know, in front of the door, so she passed you? So again, these are, instead of personalization, well, maybe it was situational, but anxious people usually personalize a situation. So these are some of the challenging thought distortions that we must sort of look at together. Problem solve what can be solved. Know the difference of, coping ahead skills versus worrying. And once you sort of done a certain triage of a fear ladder of what you could avoid, what you have been avoiding, and sort of slowly begin from the less intrusive to the most fearful type of tasks or events, then, well, if you go incrementally, once you've mastered one, and see how you've been feeling by exposing yourself in an uncertain situation, well, then you can go up the ladder and slowly and steadily, you know how it goes, it wins the race, but you also need to be realistic with your expectations. And also, once we've done all this, well, we need to maintain as well. And some of the managing our anxiety ways is very personal to you, and something that you love doing, you enjoy doing, and because ultimately you have all the internal skills to do that, and to cope with what uncertainties the future will have in store for you. Well, I truly appreciate you listening. There are many resources that exist for general anxiety disorder and coping. There's a few I listed here. There are many more. Some you could use also as self-help to understand better, cope with as well as some documents and worksheets that could be helpful for you as you go along in your sort of process of understanding and dealing with your anxiety. So if there were any questions, I look forward to hearing from you, and many thanks for listening, and have a good evening. Until next time.